Hello, everyone. This is my YouTube response, my reflection to our group grief counseling class. Grief counseling can take place in either an individual or a group format, and each distinct advantage depending on the needs of the bereaved person. In Worden's model, grief counseling is designed to help a person adapt to uncomplicated grief by working through the realities of the loss, the emotional pain, the changes that follow, and the process of maintaining and enduring connection while moving forward in life. Group grief counseling fits well within this framework because it offers people both support and a place to express their grief openly. Individual grief counseling is often the best choice when a person needs privacy, has complex relationship with the deceased, or is coping with trauma, severe depression, or intense guilt. In one-on-one counseling, the therapist can move at the client's pace and tailor interventions to the person's unique history and coping style. This format is especially helpful when a client is not ready to share personal, emotional in the front of others. Group grief counseling, however, offers the benefit that individual counseling cannot always provide. In a group bereaved, people often relieve or realize that their reaction are normal and shared by others, which reduces the isolation and the shame. Research suggests that bereavement groups can provide social support, emotional relief, and a sense of understanding that helps participants cope with the loss more effectively. I would recommend that a bereaved person join a grief counseling group when the person is emotionally stable enough to participate and wants connection with others. And of course, you feel comfortable around that person, that person is willing to protect the interest of others. And also, there would be a benefit from hearing how others people are coping with similar losses. Group counseling is especially useful after uncomplicated losses, when the person feels alone, and when the goal is to normalize grief reactions and strengthening coping through shared experience. Supporting groups can also help grieving persons begin to rebuild social connection, which is an important part of the healthy adjustment. I would not immediately recommend a group for every bereaved person. If someone has experienced prolonged grief symptoms and severe trauma, suicide thinking or ideations, or major functional impairment, individual counseling may need to come first. In those situations, group support may still be helpful later, but the client may need more private and clinically focused settings that engages them from their own beginning. Support groups play an important role in grief counseling because they provide mutual aid, validation, and encouragement. They're not a replacement for therapy, but they are an important support system that help people feel understood and less alone, and more intelligently, they feel a place where they can belong. Wording's framework is supported in this setting because support groups often help clients express feelings, adjust to life changes, and move forward or move toward a continuing bond with deceased in a healthier way. In conclusion, individual grief counseling is often more appropriate for privacy, complexity, and deeper clinical needs, while group grief counseling is valuable for connections, normalizing, and shared healing. A counselor should recommend grief group when the client is ready for interpersonal support and can benefit from experiences of others. Overall, support groups are a meaningful part of grief counseling because they help the bereaved move from the loss with understanding, structure, and community. Well, this is it, and I appreciate you listening. Thank you.